Hello, everyone. Thank you so much for joining. I'm Sade Strehlke. I'm the digital director at Shape magazine, where we cover everything from wellness and beauty and sex and just living your best life. And I'm here with the one and only Dr. Barbara Sturm, who's beloved by everyone basically that has skin on their face, celebrities, beauty editors, everyone who wants a quality product that actually works and doesn't have harmful or unnecessary ingredients. Dr. Sturm, thank you so much for inviting me and allowing me to moderate this extraordinary panel. Do you want to say a few words, just to introduce yourself, and then I'll go around to everyone else?
Hi, thank you so much. Thank you so much for doing this today. I think it's so interesting, to talk to real professionals and experts about a topic we are all so interested in. And I'm Dr. Barbara Sturm. I started as an orthopedic doctor. I'm an MD, and I was always involved with the theory of aging because, I was working on the aging process in joints.
Yes.
And interestingly enough, joints and the tissue, the cartilage tissue and our skin tissue is the same tissue family. So there's a lot of similarities, and we were always trying to get into the anti-inflammatory process. So anti-inflammation, practicing anti-inflammatory treatments on joints would help with the aging process and slow down the aging process. And it's the same with the skin. So I help pioneering the treatment where you take the blood, process it in a certain way, create anti-inflammatory proteins from your blood, from your cells, re-inject it into the joints. I translated this into the skin in 2002. You all know the vampire facial or blood facial. And yes, and from that, knowledge, I went into creating a cream with the blood, the so-called MC1 cream. Yeah, and then my patients were asking me for more and more and more, and I'm a good doctor. So I was helping my patients as much as I can, and now I'm really loving creating these products, which are, as you said, effective, the best quality, anti-inflammatory, super anti-aging in a good way. You don't pour acid on your face to get an anti-aging benefit, because that's nonsense. You do anti-aging in a healing way, and keep your cell functions, keep your skin as childish as you can, as youthful as you can. And I think that approach is pretty much changing the skincare industry, because lots of people are following this approach, which I think is absolutely necessary.
Yes, a gentler approach rather than, like you said, putting acids or harsh products on your skin to try and heal it. What I love about your products is that it's natural. It has, the special properties in it, but nothing burns. Let's put it that way. Nothing burns when I put it on.
Good. It's very the essence of everything you say.
Right. I'm going to go ahead and introduce the rest of our panelists. I'm going to start with Vicky, and I'm also going to ask everyone on the panel, you can now turn on your cameras if you'd like. Vicky, do you want to introduce yourself and tell the audience a little bit?
It says oh, there I am. Starting the video. Hi, everyone. I'm Vicky Vlachonis. I'm a European osteopath, and for more than 20 years, I've been in health and wellness, trying to help people understand their physical and emotional pain, connect with mindfulness, meditation, wellness, how they eat, how they move, just listening to people. And obviously now I have my new wellness brand, Saint Supply, and it's all come together with the Living Elixir, which is a polyphenolic olive oil full of health benefits. So I'm big on anti-inflammatory. I love, Barbara, what you've been putting out there for all these years, promoting just understanding what we put into our body matters, and the beauty and the glow from the inside out, and just finding moments with your products, with me taking a shot of olive oil and connecting the dots, how we eat, how we move, how we think, and how we feel. And I'm grateful to be here today.
Thank you so much, Vicky. And for those in our audience who might not know, what exactly is an osteopath? Vicky?
Osteopath is we take a holistic approach. Can you hear me?
Yes, I can hear you.
Yeah, we take a holistic approach in understanding the body. We take a full case history. So in America, they might call it body worker, body healer. It's understanding the physical and emotional pain and understanding how the nervous system runs up and down our spine. So we use different tools in, understanding where are these joint pains. We want to prevent chronic pain, and we want to look at anti-inflammatory ways, how we eat, how we move, to put a holistic approach and an integrated way of, from the minute you wake up in the morning and you put that cream on your face, from the minute that maybe that doesn't work for your body. So I work with a team of doctors. I'm blessed. I work with registered dietitians at UCLA, MDs, orthopedic surgeons. So it's more about taking a holistic approach and finding the right team to take care of our people who need it at the moment in these difficult times.
Absolutely. Thank you. Next up is Yalda. Do you want to tell us a little bit about yourself?
Hi, everyone. I'm Yalda Alaoui. My background is actually finance, and I've come into the field of wellness after a personal struggle. I was diagnosed in 2007 with an autoimmune disease called ulcerative colitis, and in 2012 with something called autoimmune hemolytic anemia. Barbara is going to understand what I'm talking about. No medication worked for me. Anti-inflammatory medication, steroids, immunosuppressants, anti-TNFs, nothing worked. And I realized that the thing in common between my two conditions, and actually the majority of health issues, was chronic inflammation. So I set out on a path of studying this and creating a solution for myself. I saw many dietitians, naturopaths, and no one could pin it down. It took me over 10 years of research to be medication-free, blood transfusions free, hospital stays free. And I created an online platform where now I help thousands around the world. So from not being able to be helped by doctor, I'm now healing doctors with different chronic diseases, which follow this lifestyle, which is basically, like all of us are talking about now, a mix of food, mental wellness, and the right anti-inflammatory movement.
Wow, Yalda, I am going to have so many questions for you. My 3-year-old was actually just diagnosed with either ulcerative colitis or Crohn's disease. It's been, and obviously he now is on anti-inflammatory medications, but when you have an autoimmune disorder, sometimes you go on these medications for life, and I definitely would like to avoid that. So I am going to have a lot of questions for you, and obviously the gut is very related to anti-inflammation throughout your body. But I want to get to our next guest, Iván. How are you? Thank you for waiting so patiently. Do you want to tell the audience a little bit about yourself?
Sure. Good morning, everyone out there. Good morning, beauties. My name is Iván Pol. I am the creator of the beauty sandwich, everyone's favorite beauty carb, with no gluten and no guilt. It's the only sandwich that you'll have that makes you instantly skinny. I've been in beauty for about 20 years. I used to be a makeup artist in the fashion industry before I went into cosmetic dermatology 12 years ago, where I began to pioneer my method. I'm originally from South Florida, where I also live, and I'm currently in sunny, beautiful LA. And my method is all about a natural alternative or a natural approach to anti-aging. It is free of chemicals, injections, lasers, anything harsh on the skin. I believe in building and strengthening the skin from within so that you can look your most radiant self, and in a natural, holistic way. It's a beauty technology.
Got it. Thank you, Iván. And last but certainly not least, Whitney from Sakara Life, who many of us know because they make delicious vegan foods. And I personally am not a vegan, but whenever I get to taste your creations, they are phenomenal. So Whitney, do you want to introduce yourself a little bit and just share sort of how you got into, Sakara?
Yeah, absolutely. And I'll start off by saying I'm not a vegan either. And 95% of our clients are not vegans as well. But they're people who understand that to really work on healing the gut and reducing inflammation overall. Plants are an essential piece of that process and essential to your overall diet and well-being. So, but they can be difficult to incorporate into your everyday. I say that most people live on bread, meat, cheese, coffee, and alcohol as the 5 major food groups. But those are all inflammation causing foods. And it's difficult to get enough fresh, organic produce into your body on a daily basis because it's things that will live and die in your refrigerator. But those things are the things that are going to change your gut microbiome, that ecosystem that lives inside of our bodies that work in symbiosis to help keep our bodies healthy, and to also stabilize our blood sugar. So I came to starting Sakara after a decade-long battle with cystic acne. I went to see every dermatologist out there. I did Accutane, I did rounds and rounds of antibiotics. Unfortunately, I did lasers, CO2 lasers, all sorts of lasers, creams, you name it, I tried it. And the acne just kept coming back. And it was because I wasn't treating the root cause, which was what was going on inside my body. What I didn't realize was that my feminine ecology issues were also stemming from the same problem. My anxiety was stemming from the same problem. It was all connected to what was going on inside of my gut. And so my business partner, Danielle, and she was on a path going to medical school, switched to study nutrition, and we came together to create a program just for ourselves at the time. It wasn't even a business, but it completely transformed our bodies and our health and our lives. And it put us on a mission to help more people discover the power of plants and food as medicine. And you're talking about ulcerative colitis and Crohn's. We're actually in process of doing a study with a major insurance company right now because they are finally coming around seeing that food and nutrition does actually impact these major chronic illnesses, and how eating a high fiber plant-rich diet, you don't have to be a vegan, but getting enough plants into your diet can really have a major effect on these types of chronic diseases, as well as other ones like acne and so on.
Thank you, Whitney. Before I get to anti-inflammation, which is something that you're very passionate about, Dr. Sturm, and obviously we're all very passionate about here, I just want to take a moment to honor the reason we are all here, which is Dr. Sturm's new anti-aging cream. Dr. Sturm, I've known you personally for about 3+ years, and I think 4 now, and I know every single product that you put thought into, and you also have the serum, but I know every single product that you put out has so much thought and detail in it. Do you want to go ahead and tell everyone a little bit about this?
Yeah, because that one is really actually amazing. And everybody knows all my products are anti-inflammatory, hydrating, nutritious, telomerase activating, which are like the 4 really core characteristics of every single of my products. With the super anti-aging cream now, we had like a quite super expectation approach, and we've been working on this cream for over 4 years, and it was never good enough for us to throw it out. And now it's really packed with anti-aging ingredients. And normally face creams, they target 1 or 2 things, protection, hydration, helping with the lipid function, but not really much more. So cream is really like this all-rounder. And with this cream, we really target 360 degrees of our aging symptoms. So number one, the base itself is already so special, and we use ingredients which mimic our own skin structure. So it has like phospholipids, triglycerides, ceramide, squalane, like ingredients which basically restructure your skin. So it's like a second skin. So when you put it on, it's very rich, but it doesn't feel that rich because it smoothes into the, skin has these, I don't know, lamellen, lamels, I don't know what you call it, but anyway, it smoothes in. That's the number one. Then the second thing, which is fantastic, we use an ingredient, tefrenone, and that is an ingredient which supports the telomeres. That is like in a high concentration, besides purslane, besides skullcap, which also supports the telomeres, but that is the most proven anti-aging theory, lengthening telomeres. So that's the second thing. But also it protects your DNA and supports all cell functions, which also makes it like an anti-aging tool for every cell function we have, So that is amazing. Then plankton extract, which not only supports the collagen and elastin synthesis, but also helps to fill in fine lines and wrinkles instantly. And this turtle root in a very, very high concentration. And that is very interesting, actually. I have this turtle root in lots of my products, but not in that concentration. And, if we think about skin layers, we have the derms and the epidermis. And the epidermis doesn't have blood vessels. It really gets neutronized by the dermis, which brings the ingredients or nutrition via diffusion. So when we age, it loosens it up. The conjunctions between those layers get loosened, and the diffusion doesn't happen that much anymore. So this bisturta root really glues that together, which is amazing. So the idea really of this cream is to keep our cells, our skin structure, our skin functions, because when we look at a kid's skin, tight cell conjunctions, tight, they don't get, and your skin looks like a kid's skin, so it's amazing. Your skin is perfect, tight skin, plump, and when you look at a kid's skin, it's never dehydrated, it's never dry.
Always, and my skin looks plump because I just had a baby.
Yes, it's never dry. It never really dries out because there's no transepidermal water loss. But when we age, this conjunctions loosen up, cells get all over the place. They're not situated like soldiers, and that's when the transepidermal water loss happens. So we really need to take care of our skin barrier, of our cell functions. Obviously there's also hyaluronic acid in the cream, there's panthenol in the cream, there ingredients to catch free radicals. So it's just such a power tool, and nothing else would fit into this cream. We're all obsessed, everybody is just using that cream now, and that's why I thought it's good to really also discuss and talk about it, because it's such an important, and this cream is for mature skin, it's not for the 20-year-old. This cream is for 40 plus. That is mature skin face cream. Yeah. So I think that is really important that we really target and really do something for everybody who says, I have sagging skin. I need to, it's like this aging skin where we have to really have built something. And this is really, we're super excited about this cream.
Well, I'm still going to try it. I don't care if you say it's for more mature. I'm still going to try it and use it. And then maybe
I put it on. Look, this is how it looks.
Yes.
This is how it looks.
You were talking.
Look, when you say the consistency is, oh my God, it's so insane. And then you see it goes right in, and it's really actually rich. It's a rich cream, but because it mimics our own cell structure and skin structure, it really goes right. So I need to use this one for sure.
My next question, since we're talking about the anti-aging face cream, I'll let Vicky take this, but can you, and maybe Dr. Sturm, you can jump in too, can you explain exactly what happens to the skin when it ages and how that's related to inflammation?
Should I start? How do you want to do?
You or Vicky.
So aging process, the most proven aging theory really lies in the number of cell divisions. So our humans, we have 40 to 60 cell divisions. A turtle has 110 cell divisions. So a turtle gets to live over 200 years. So that's a life limiting factor, the number of cell divisions. So when we age, I just talked about the tighten conjunctions between skin cells. They loosen up, water leaves the skin, dehydration, unevenness, wrinkles, etc. Dehydrated collagen, elastin, the nutrients don't come into all the skin layers because of the dermoepidermal conjunctions. Then we have stresses like sun, pollution, HEV light, our diet, obviously no sleep, stress, causing inflammation. Inflammation causes aging. So all these factors, then maybe hormonal loss, yeah. All this comes together, we get hyperpigmentation issues, wrinkles, dryness. So all these things we can definitely address, but it's the normal way of, degrading, not just skin, but in our entire body. So that's why we need to really make sure we go through all of our skin cell divisions, because lots of treatments really try to attack our skin, and our skin is a functioning organ. So, we cannot attack an organ. We wouldn't attack our liver or our colon or our heart. We wouldn't dare, but with our skin, we throw acid peels on, glycolic, retin-A, name it. Like, let's put laser on it. You wouldn't, when Whitney just talked about the microbiome in your gut, we have a microbiome on our skin. It's like, alone if you put too hot water on it, or fragrances in creams, or you use an antibiotic cream or a cortisone cream, you already disturbed your microbiome. Bam, if it's in disbalance, there's all kinds of things happening. Bacteria go into your skin barrier weakens, you have transepidermal water loss, there's an inflammation cascade starting. So all these things which you think only happens in your gut, we have a microbiome sitting everywhere, yeah. And this needs to be respected. And while we say, okay, we shouldn't drink alcohol, or we shouldn't eat, fried food, or processed meat, whatever, we should have a high fiber plant-based diet. It's the same with the skin. We should have ingredients on our skin which actually respects our biotope on the skin, our microbiome, our skin structures. I think it's the same way, and I think that's the anti-aging. That is the new anti-aging way to deal with your skin, instead of going for anti-aging products which say don't use it when you're pregnant. I mean, come on. If a product says don't use it when you're pregnant, why would you use it at all? I mean, that should be like bam, bam, bam.
Should be the first red flag. Yes, I agree. And then Yalda, do you want to talk a little bit of how, once you sort of did your research after being diagnosed with this autoimmune disorder, how you tempered the inflammation in your own body using diet?
Yes, so basically what I did at the beginning, unfortunately, because I was so unwell, I had to do an elimination diet, but the other way around. I removed everything, and the only thing really that I could digest was bone broth, because it's collagen and it's full of glutamine, which is an amino acid which rebuilds the tissues, joints, skin, and the gut lining. So that was the first thing that I could take on. Then the second thing, so I was making chicken soup, then I could eat the chicken in it. So I reintroduced, and basically every 3-4 days, it was a very lengthy and awful process, I would introduce a new food to rebuild. Like a baby, I was weaning myself and trying to rebuild the gut bacteria, which I had lost, because at that point I became intolerant to everything and lost so much weight, all of that. To cut a long story short, my path was not a straight line. There were ups and downs, but the curve was going up. So I knew I was going towards the right direction. So it was diet first. And then as soon as I got better, I wanted to work out again. I'd book my personal trainer. He'd come, we'd do intense workouts. I'm super competitive. So whatever he gave me, I did. And every time I saw him, I had 3 days in bed with all my symptoms of colitis coming back.
Okay.
So I started doing research, and I realized that intense exercise, which seems quite fashionable at the moment, is extremely inflammatory.
Right.
So sorry, I think there's a problem with my internet. I was able to go back to working out by doing very gentle yoga, gentle Pilates, and slowly, walking.
Mm-hmm.
Can you hear me?
I can hear you.
Hello?
Yes, I can hear you and see you.
Okay, cool. And doing walks versus running. I started developing my own anti-inflammatory workouts, because even when I started going to yoga again, being me, I pushed it too far. I started doing a lot of Ashtanga, and then bang, I had a disc bulge, and So, and I started researching working out, and actually it's so important to do low inflammation workouts, but also strengthen your core, because the vagus nerve links the spine to the gastrointestinal tract. So having a strong core, which literally holds your insides and allows for good gut motility, will strengthen your immunity, lower your inflammation. And last but not least, stress is a massive part of it. So whenever you stress and you produce cortisol, you switch on your sympathetic nervous system, which basically switches off your digestive system, your immune system. The parasympathetic nervous system is responsible for rest, digest, and reproduce.
Yes.
So that's how I came to do all of this, basically. And I never intended to help people. I was just in my little bubble. I wanted to get better, be able to be a mom and enjoy life again. I have 2 young children. I mean, they're 11 and 13 now, but then they were, when I almost died, they were 2 and 4. So I wanted to live, to be there for my kids. And I could see doctors getting, I was getting all these blood transfusions for my hemolytic anemia, and I could see them struggling. I was developing antibodies, and in my head, not for a second did I ever see myself not getting better.
Right.
I used a lot of prayers, and I didn't know what I was doing was visualizing. So I was tapping into epigenetics and neuroplasticity. I didn't realize I was doing all of this with my lifestyle. Anyway, I got better, and then a friend of mine convinced me to create Eat, Burn, Sleep, and that's how it was born.
That's how it started. Vicky, do you have any similar stories or, sort of advice for people who come to you with, chronic disorders? As I shared, my son was diagnosed. They can't quite pin what it is yet because of his age, but he was diagnosed with either ulcerative colitis or Crohn's. His paternal grandmother has it, and I have lupus. And I noticed.
I love that you put that out there, and thank you for sharing, because it's all about looking at the family history and understanding where we come from, and understanding that everybody's unique, and Yalda's story is so unique, and she took the time to be mindful and create rituals that work for her. Rituals that she's listening to her body, respecting her body. This is, for 20 years, obviously I've gone on tour with people. I'm sorry, my little cookie's barking. I've gone on tour taking care and just understanding how we eat, how we move, how we feel. So patients might come to me with acute neck pain, and I might be like, okay, it might be the thyroid issue or maybe low vitamin D, but what is your body trying to teach you? So let's take that holistic approach and listen and understand. But first of all, food is medicine. And what we put into our body matters.
Yes.
And even keeping a food journal and having somebody to talk to, like a registered dietitian. Obviously, I'm an ambassador at UCLA's Digestive Diseases Division, and for Saint Supply, for the Living Elixir, a new hero product for the new wellness brand, I teamed up with Dr. Fowler and Nancy Jaffe. And it's all about learning about the microbiome. We're still learning how this is affecting our mind, how it's affecting our skin, our movements, our sleep, our body, and just taking a holistic approach. I love everything that you ladies are putting out there, but you're not alone. You're not alone. I know this is your beautiful baby, but it's about the whole family understanding. We all got to make changes and start the anti-inflammatory diet. And obviously I'm a big believer on the Mediterranean diet and starting looking at foods that, yes, we want those plant-based foods. We want the polyphenols in the olive oil. We want the squalene in the olive oil, because it's not the olive oil, for example, for my new product, it's the polyphenols, these natural plants that Mother Nature has gifted us.
Right, absolutely. Whitney, I know, I think most people associate you with food and, again, these like really chic, like prepackaged meals. They also, again, taste really good. But I want to know, like, how do you, Yalda, shared that she really tied in mindfulness and, not, and you did say prayer, but more of like visualization of what, like this is not going to be the end for me. I'm going to get out of that. How do you incorporate that in your life too, in your philosophy, in terms of not just what you offer at Sakara, but also just in your personal life?
Yeah, absolutely. I mean, it all starts with the thoughts that we think. And one of Sakara's taglines is thoughts to things, and what I think I create, and taking some of that personal responsibility that we, as difficult as it might sound, we can choose thoughts that we think. And I think that's a big part of practicing meditation, is the practice of slowing down the mind, being aware and conscious of the thoughts that come in, and choosing to allow them to pass by. And when we can separate and say, well, maybe this ego conversation that I'm having with myself, saying I'm not good enough, I'm not smart enough, I'm not pretty enough, I'm not skinny enough, I'm not young enough, whatever it is just a voice and a thought, and I can start to put that aside. I think that body confidence, or confidence in general, is something that we all deal with, everybody, no matter how successful you are or what you may look like. It's something that it creeps up into our minds all the time. And I think if we can start to distinguish between what thoughts I'm choosing to have about myself and those thoughts that come through, can have a really big impact. And even with choosing then what foods to put into our bodies, it's all connected.
Yes.
And actually it goes the other way too. The foods that we put into our bodies affect the thoughts that we think as well. Because of that connection between the gut-brain axis, our microbiomes, it's all connected. And so taking care of ourselves in each area of our lives, whether it's our food, our skin health, which for me is a mini ritual, like getting to do serums and creams. Now I have a young baby too, and it's hard to do. And so when I do it, it is a form of meditation for me. And I will mention that nutrition plays a huge role in overall mental health.
Because it affects
more and more.
Levels.
Yeah, your vitamin levels, and especially as a mother, I'm not sure if you're breastfeeding or not, but you're giving a lot of that nutrition to the baby when you're pregnant, and then after, to feed the baby, it's taking a lot of that nutrition from you. So making sure that you're taking great supplements, to replenish your nutrient stores, because all of that can affect your brain health, your mental state as well. So I make sure to take, we have a great prenatal at Sakara. It's all food-based with superfoods included. So it's more bioavailable for your body to absorb than with synthetic supplements.
I actually didn't know that you had a prenatal. I will try that if I ever have another baby. I will try that.
Well, and we have the foundation, which is our supplement line. They're packs of supplements, just for everyday use, great for everybody. And they really support energy levels. I feel such a difference when I take them or when I don't.
Yeah, I'm going to order that right now.
Yeah, and know that if you are breastfeeding, there are clinical studies that show that what you consume gets passed to the baby. So if you're taking over 6,000 IUs of vitamin D, then that can actually go into your breast milk to the baby, instead of giving your baby drops like many people recommend. And same with probiotics. So making sure you're taking enough probiotics right now to get to your baby, which I'd say probiotics is great for skin, it's great for gut health, great for mental health, really building up that gut microbiome.
Absolutely. Well, thank you for that. And my baby actually isn't that young anymore. She's almost a year now. She's 10 and a half months. So I'm not breastfeeding anymore, which for me, thankfully. But I do know, how important it was when I was breastfeeding to really nourish and supplement my body so that, not only did she get all the nutrients that she needed, but also that I was replenishing myself. Because especially after you've just given birth, it's a big burden on the body.
And as we're looking at aging, making sure that we're maintaining nutrient levels is a huge piece, especially going into menopause and beyond.
Right.
Making sure that we're maintaining healthy nutrient stores, which you can have your blood tested by your functional medicine doctor to make sure that your vitamin D levels are high, especially in the world of the pandemic.
Right.
That affect the immune system. But all of those different levels play a role into cellular health, as Dr. Sturm was talking about, and overall aging.
Yes. Iván, thank you for being so patient.
No.
But I wanted to get your take because you were a makeup artist and you work in beauty, and so much of anti-inflammation and aging, like it does have a huge relation to sort of stress and confidence. How do you make your clients, make the people that you interact with daily feel confident, and how do you yourself through your work with beauty and so on, like feel confident? Like if you could give your best friend 3 tips on like what to do to make yourself feel confident, so no matter how old you are or really what you look like, or if your diet isn't 100% there, you still feel good about yourself, so you're minimizing that risk and that sort of internal damage that you're putting on yourself.
Absolutely. So, my tag phrase, I always say, a lot in my Instagram and in all my emails, it's, don't forget to look at yourself in the mirror every single day and tell yourself you're beautiful.
Right.
I mean, I do that. I recommend that to every single one of my clients when they come to see me, because self-love is the ultimate love. It all roots from there. You can't go into a beauty regimen, whether it's a diet, whether it's a wellness program, without looking within and kind of loving yourself first.
Yeah.
And we're all beautiful, we're all special, and we're all so unique. And that's what makes us really, truly, truly beautiful and truly ageless, right? When we love ourselves and love the skin that we're in, and we're not about chasing a number anymore, but about looking our best in the age that we are and in the skin that we are. I remember when I was in my 30s, I'm 44 now, I was all about, oh my God, I need to look 20. The moment I stopped that mental dialogue in my head, everything changed for me. And that's when, I was able to really go into and discover the beauty sandwich, because, working in, I worked in the top 5%, practice, top 200 offices in South Florida, in the nation for Allergan. So we saw between 80, sometimes 100 patients a day. And what I would hear on a daily basis was, what can I do, to look my best, right? Without a chemical, without a needle, without these lasers, without all of this. And that's how the beauty sandwich was born. I work on the living skin, like Dr. Sturm was talking about. We have the epidermis. That's about 7 layers of dead skin. I'm working, in dermis at 3 different levels. That's why I call it a beauty sandwich, because it's stacked like a sandwich. I'm working on your living skin. So I wanted to give something to women predominantly, because they're moms, they're working, they don't have sometimes times to put on like a whole system, right? Yeah. So, my facial treatment, it's like, it keeps on giving. So you see me, it's like a trainer that if you could see, instead of 3 times a week, you see every 4 to 6 weeks, and it keeps working.
Right.
And the first thing I do before I start any treatment is we set an intention for your treatment, right? I say it's love, beauty, energy.
Yes.
Those are the core, basis, because I work with radio frequency. It's an energy, it's a healing thing. So, if you set that intention for yourself every day, and then you use beautiful, clean products, because what I, again, saw on a consistent basis, especially when women come to me, they say, I'm feeling tired. I'm feeling that my skin doesn't have any vibrancy. It doesn't have any bounce. And I'm feeling kind of jowly and heavy. Right. So number one, I ask, okay, what products are you using? 9 out of 10 times they're on a heavy retinol or a retinoid. They're on some sort of harsh exfoliating product. They've really battled themselves with lasers They have some gut health issues, and they're not doing anything to like nourish and heal.
Right.
I mean, down to your cleanser. Okay. This microbiome, our skin is our largest organ, I call it the gentle giant.
Right.
We have to be so caring and nourishing to our skin and use things that don't disrupt the acid mantle, the microbiome. And then also holistically, we got to look at, the beauty foods that we're having, foods that are going to aid in that beauty process. Because if you come to see me, yes, I can make you instantly lifted, right? And that will continue. But if you are, having a high acid diet and, it's not going to be, or, overdoing it with sun and then, it's again, things that cause too much inflammation. So again, be gentle, be kind with yourself, be patient with yourself, love yourself, and look to just looking the best for your age and in the skin that you're in.
Absolutely. And I think that, when people really realize it's not about competing with this person or looking a certain way, but just, doing the best that you can and taking care of yourself from the inside out. I personally have found that that's when, you can stop worrying about all of these other, little sort of superficial things. And like you said, like the beauty from the inside will shine through, if you're eating right, sleeping right, exercising. It doesn't have to be perfect. It doesn't have to be extreme, but that's when you feel your best, when you know that you're putting the work in and you can feel and see the difference.
Yeah. Sleep is another underrated. It is the most underrated beauty secret out there. I sleep on a completely non-toxic mattress, from Sweden. It's called Hastings.
Because it's National Sleep Month. What's your mattress? Tell us about your mattress.
So I sleep on Hastings. It's Swedish for horse, and it's a completely non-toxic mattress. You can take it to the micro part, it has no artificial things. It's made of cotton, flax, wool, and horsehair.
Right.
And I have to tell you, I've been sleeping on those mattresses for over now close to 7 years. When I opened my spa, I couldn't put my clients on a foam and latex.
On a regular mattress. Right.
So, I'm the only spa in the world to have a Hastings, custom made bed for me, so that when you're getting the beauty sandwich, you're also getting some beauty sleep. So
I'm going to come visit you soon.
Yes.
But yeah, that's a great point. Sleep is underrated. And I do think that now, people are starting to realize the value of it, and it's sort of being called as, the fourth pillar of wellness. But it's, but before it was kind of like, oh, I pulled an all-nighter, or, I can drink 5 cups of coffee and go for 24 to 48 hours or something. And people don't realize how harmful that is to your system and how much your body needs that sleep at night to recuperate and, to feel good and restorative. So thank you, Iván. I don't know how many people are going to get Hastings mattresses, but I have heard they're great. And I do actually think that, looking into what your mattress is made out of, is something that people tend to forget and not think about it. But you are lying on that for, 8+ hours per day. I think it's, it's a huge chunk of your life.
Yes.
You want to make sure that it's non-toxic and that it's not something that's going to cause some sort of long-term harm that you're not even really cognizant of or thinking of.
So what happens is on an average, we sweat about 1 liter or more at night.
Right.
What happens if there's foam or latex in the mattress? That our body temperature rises mostly as we sleep. That sweat goes into the mattress, and then that's hot, and then the foam and latex release an off-gassing. That's highly toxic for not only for us to breathe, but it's highly toxic for our skin.
Right. Okay. So before, I think we have about 15 minutes left, maybe a little less, but I want to just go around, and I'll start with you, Vicky, since you're first on my list, about how you view anti-aging and what you have sort of, you can tell us your favorite product or how you view it. When you first thought about aging, was it something you thought that was scary? Like, what's your viewpoint on aging and anti-aging?
So I'm going to go back to what Yvonne said about the mirror. And, you know, I come from a mom who taught me meditation, prayer, looking in the mirror and giving that self. So for me, age is a number.
Yes.
I believe in finding moments where you are either dry brushing your body and taking care of your skin, getting into the shower and feeling that this is going to rejuvenate me. When I take my shot of olive oil, I'm saying, thank you, God, for this body, for this movement. I'm stronger. I'm putting something in my body that's going to nurture my body. I do my 5 Tibetan poses. I actually have a cold shower. I have all these tools where I'm so energized. I don't think of anti-aging as, I don't think of age as a number. Like I work with people in their 90s and they do the 5 Tibetan poses. You know, I know people in Greece who take shots of olive oil, take naps, they sleep. Sleep is a major thing, but mindfulness, prayer, meditation, movement. And you don't have to run a marathon. You don't have to go up the mountain to meditate. We could do it all now. And we've learned more during the pandemic how to take care of ourselves. And I think we've had this opportunity to find ways to live longer. And I wanted to ask him, is there an orthopedic pillow? Because I love this. I haven't tried the mattress, but do they have a Tempur-Pedic pillow? Do they have it? Because I'm big, I travel with my pillow, my eye mask, my phone sleeps in my bathroom. Sleep is a major thing. And in Greece, we nap, we take a lot of naps. I want to know about the pillow. Do they have
So they don't have an orthopedic pillow, but they have an amazing travel pillow.
Okay.
That I'll get it to you. So if you reach out to me, I'll make sure you'll get a pillow from them. It's a wonderful travel pillow that folds over. The great thing about their pillows is that it goes through a 9-time stringent process to make sure that like dust mites can't really grow in this. So it has like all these environmental regulatory like things from Sweden and Europe.
Got it.
But it's not orthopedic.
You also believe in the silk. I travel with, but I believe in a moment of saying, you know what, I'm just going to take care of my skin. I put on my creams. I've taken care of my beautiful face or my skin, but now my pillow is also silky.
Yalda, what's your philosophy on aging and anti-aging?
So the first thing is I don't see aging as a curse. I see it as a blessing. I'm half Moroccan, half Persian. I come from a culture where older people have wisdom and it's a good thing to age. The second thing is I want to age really as naturally as I can. And what I like about all the people on this panel is everyone is very much aligned and everything you're talking about is things that are very close to how I feel, you know, the whole sleep thing, the diet, the mental wellness, and applying great products. So for as far as I can remember, I spent money in beauty products. I always have. My mom always taught me. I always did the Moroccan scrub once a week, you know, put argan oil all over all of that. So I enjoy all these rituals that make me feel feminine and which make me feel that it's not about wrinkles or it's about looking healthy. I want to age having bright eyes, energy, looking healthy, and that comes from within. So I follow a low anti-inflammatory lifestyle. A lot of people who join my platform tell me that their rosacea gets better, acne gets better, fine line gone, and all of that because it's linked to inflammation.
Right.
And I can see on myself when I overindulge, I have slight, you know, melasma pigmentation that comes back.
Yeah.
My fine lines start showing up. I get a little puffy, I get water retention.
Yes.
So I'm completely relaxed about aging because I know what I need to do, which is look after my body from the inside out. And I don't want to start doing things to my face and look a different person in 10 years.
Right.
So I'm trying, you know, I've never done anything. I'm 42 years old. I've never done anything. And I'm very much like Barbara, I line into a gentle approach. And that's a doctor thing, right? First, do no harm.
Right.
And sometimes less is more. And you know, the French say, le mieux est l'ennemi du bien. Sometimes wanting to do more is best is the enemy of better.
Right.
Sometimes it's, you know, it's better to go slow. And that's my vision of it. So I just want to be able to move my body, feel great, have lots of energy as I'm aging.
Absolutely. And I think my family is South American, and they live very, very long, and they're all super healthy. And, you know, they eat really healthy, natural food. You know, in South America, they, you know, walked a lot. They were not afraid back then of the sun, which maybe they should have been, but you know, they look great, and they feel great until, you know, well past, you know, their late 90s. That's when they start acting like people in their late 70s to early 80s. And I think it all just, you know, has to do with sort of, you know, loving life, living easy, and, you know, we have a lot of stresses now that, you know, we have to try and mitigate and get around, and those all add to aging, you know. I know we only have a few minutes left, but Whitney.
Hi, sure. I think about, instead of lifespan, I think about health span, and how can we continue to live healthy way into later years of our life, and that when we come from a place of health first, it is naturally going to affect how we look and how we feel, which affects how we look, that it's all connected. I'll also mention water. Dr. Sturm talked a lot about cellular turnover, and water and hydration is a huge piece of that. One of the ingredients that I love in her new super anti-aging cream are ceramides. And so ceramides help seal in that lipid barrier that she was talking about on the skin, which degrades as we age. And so that can help seal in moisture, but then you also need to be hydrating, making sure you're getting enough minerals with your water, that you're drinking high quality water. And you can also consume ceramides that help build up that lipid layer as well, going from the inside and the outside. So I'm definitely a big fan of this holistic approach, taking care of your body from your nutrition, from your mental health, getting hydration, and then using those creams and whatever else possible to do what you can on the outside, because how you look definitely affects how you feel about yourself and how you show up in the world. We might want to say that it doesn't, but it does. And I don't think that we should be ashamed of saying that or feel bad about it, that it feels good to, when you feel good about yourself.
Absolutely.
And that energy can help us stay young and healthy later into our years.
Right. And I also just want to add to that, it's not so much about, you know, the number on the scale or how many wrinkles you have, you know, because that sort of, it happens naturally, it ebbs and flows, you know, where you are in your life. But it really is about, like, are you, you know, and it's not always easy to do this, but, you know, what level of care are you giving to yourself? Are you sleeping? Are you eating right? And when you start to feel that, your stress level, when you start to do that, stress levels go down, you feel better, you naturally, honestly, just start to look better. And that sort of boosts your confidence. And, you know, and when you do stuff like that, like Vicky said, that you don't really have to be afraid of aging. I mean, all of you basically said that, Yalda, Whitney, you know, you don't have to be afraid of aging, because, you know, we all age. If we're not aging, then we're dead, right? So we're all going to age. So you might as well accept it. But it's not how you feel as you age, right? That's really, because if you're in your early 40s and you have knee pain or your health is failing, you know, then it's not, then, you know, what's the point? You know what I mean? Iván, really quickly, what is your viewpoint on anti-aging? And I know you sort of touched upon it in your other answers, but I want to hear more from you anyway.
Yes. So, you know, beauty is a state of mind. It's a feeling. And aging is okay. It's, you know, as my, you know, a beautiful client, Renee Zellweger, says, it's the price of admission.
Right.
I'm happy to be here, right? So it's the price of admission, you know, love the little wrinkles, it's okay. And really take the time to not only set an intention for your like financial goals, but set an intention for your wellness and your beauty. And take those moments to breathe. I mean, breath is absolutely free. And it is one of the most essential, it's the most essential thing that we take for granted. So take the time to breathe in those moments. Breathe in your creams, you know, take the time to take some deep breaths and set those intentions before you start your beauty regimen. And of course, don't forget to tell yourself you're beautiful every single day.
Yes.
So that's it.
Thank you so much, Iván. Dr. Sturm, do you have anything to add to your, well, it's a little tricky for you, but your personal philosophy, like maybe if you weren't Dr. Barbara Sturm, philosophy on aging, which I know it's in everything that you do from, you know, when you were a surgeon to your skincare now, but if you have anything else to add, we'd love to hear it as a final thought.
First of all, I think I want to agree to everybody talking today, and I'm so happy to hear all your approaches. And a couple of years back, I was all by myself talking about anti-inflammation without knowing you, so you might have talked about it back then as well. But I see so much talk about anti-inflammation. It just makes my heart jump, because that is really the biggest culprit in, you know, diseases, aging, undergoing tissue, autoimmune disease, name it, everything goes together with inflammation. And understanding inflammation and understanding how to address inflammation, how to get inflammation under control, that is the key. And everything being said today is all a way to reduce inflammation. And that is what makes me totally happy. And I think I want to add like two things. I think it's also a mindset, you know. I think we're, you know, I'm 49 now. I feel like I'm not 49. I feel like, you know, whatever, it's a number, but, you know, I want to jump over the fence with my 6-year-old, you know. I want to make sure I can do this. And when we talk about joint problems or similar, so I think we need to really work on our posture and our muscles, but also, you know, it's like the holistic approach of everything we do to keep ourselves in good shape and keep ourselves in a way that we can really enjoy life. And, you know, this is another thing, enjoying life, not just, you know, living like mules under the earth because we want to hide from the sun. Do we know how important the sun is for us? Some people think, oh my God, we cannot be in the sun, this hat, this umbrella, this sunscreen, long sleeves, you know, I mean, it's ridiculous, you know. The sun is really so important. And I just want to add this to this discussion. The sun not only gives us wrinkles, and I agree, yes, the sun does a lot of signs of aging for us and causing free radicals, but it also, you know, produces our vitamin D, helps our joints, our immune system, nitric oxide for our respiratory tract. There's so many functions, mental health, endorphins. I mean, we just talked about the weather. You're so much happier when you're in the sun. So let's just all embrace what we got from this earth to live, and not just, you know, trying to avoid any little type of aging, because we age in another direction if we don't really help our immune system, our bones, our joints, our respiratory tract. So I just want to, you know, I'm not saying, you know, don't use sunscreen when you go in the sun. I'm not, you know, saying that. And I really want to make this clear. I just want to, everything in balance, you know, just it's not being like obsessive over stuff. I don't know. I think it's so wonderful to have everybody on this panel today and hear all your thoughts. And I'm so happy that we all basically speaking the same language. And I'm throwing one question out there. Why, if we all think the same way, and we're all educators, we all have patients, we all have, you know, such a big following, why are people still throwing acid peels and using retin-A on the skin? I just don't understand it. So let's educate, let's you know, do this mission, especially in the skincare industry, which is run by marketing and empty promises. Let's really use this mission to change the skincare world into a better, much healthier world.
Absolutely. Thank you so much, Dr. Sturm, and thank you, Yalda, Whitney, Vicky, and Iván. It's been such a pleasure. You can follow Dr. Barbara Sturm on Instagram. You can visit her website. The same goes for everyone on this channel. I definitely suggest you check everyone out. Thank you so much, everyone. Have a great day. Bye-bye.
Thank you, guys. Bye, everybody.